Hi, everyone. Welcome to Preemie Chats. Thank you for joining us. I am not Fabiana. I am your guest host for the day. My name is Leah Whitehead, and I am a preemie mom and a volunteer with the Canadian Premature Babies Foundation. Canadian Premature Babies Foundation is also known as CPBF, and it is a charitable organization, and its mission is to support and educate Canadian families of premature babies. This Preemie Chat series is one of the many ways that CPBF shares information with NICU families and healthcare professionals. Here every Friday, we talk to experts, researchers, and parents about their NICU experience and knowledge. And we want you to be part of this discussion. So please let us know you're watching by commenting below or asking a question. And be sure to check out the CPBF website. It's canadianpreemies.org, and there you'll find all kinds of resources and support. Parents are the most important people and intervention a baby can have in NICU. But NICU itself can be disorienting, that's to say the least. So on this website, you will find resources like the new video series, Welcome to the NICU, that hopefully will help you feel like you're just a little bit more prepared for NICU and that you recognize your invaluable role there. And right now, in the face of the fears of the pandemic that's going on, CPBF has put together the Parent Care Program. So they offer 4 therapy sessions for families currently in NICU or those who have been discharged up to 3 years. To apply for the Parent Care Program and watch the videos, visit the website. And now today, we are going to talk about understanding the complexity of NICU-to-home transitions, specifically for adolescent parents. Discharge from NICU can be complicated. There's a mixture of feelings, preparations that need to be made, and education to be completed. And for adolescent parents, there's a whole other dynamic. In fact, adolescent parents are experiencing at least 4 overlapping and intersecting transition events: becoming a parent, caring for an infant with complex needs or with increased risks, moving from hospital to home, all while navigating the developmental journey of becoming adults themselves. In this talk, we will discuss transitions, specifically this complex intersection of multiple transition experiences for adolescent parents in the NICU, and how to support transition success for young NICU families. I am thrilled to have Dr. Elizabeth Orr joining us live from St. Catharines, Ontario. Dr. Elizabeth Orr is an assistant professor in the nursing department there at Brock University. She's also a registered nurse with clinical practice in pediatric, maternal child, and neonatal nursing. She'll be sharing with us today about her current research, which focuses on understanding the complex processes of hospital to home transitions, specifically the transition from NICU to home among vulnerable populations. What an amazing and often overlooked topic. Thanks for joining us today, Elizabeth.
Hi, thank you so much for having me. Great. So I do like to begin every presentation with a land acknowledgement that we do in Canada to really give honor and thanks to the land on which we are privileged to learn and live and grow. And so I'd like to begin by giving honor and thanks to the Haudenosaunee and Anishinaabe nations as the traditional inhabitants of the land where I'm presenting from today. So today in Hamilton, because I'm at home. And to say that this is to acknowledge a debt to those who were here before us and to recognize our responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to this land. So, like mentioned, I am going to be presenting on my research today, which is understanding the complexity of NICU-to-home transitions for adolescent parents. And I choose this picture. This is a picture of my son, Henry. He was born big, he was late, and he was a little too laid back when it came to the breathing aspects of being born. He's now 6, still big, often late, and has maintained his laid back attitude, but overall happy and healthy. But I choose this picture to start our chat because it really helps to explain my interest in the topic of NICU-to-home transitions. So I had been a neonatal nurse for almost 10 years before Henry spent about approximately 12 hours in the NICU. But it was that experience, however brief, that left me thinking, if a neonatal nurse with a graduate degree and an extensive support system could struggle with transitioning home from the NICU, how do other parents do this? Especially parents and families experiencing multiple vulnerabilities, such as adolescents. And so this research project was really one of those, being able to tackle one of those problems that keeps you up at night. And that problem keeping me up at night was this transition for those more vulnerable families and how they made this complex NICU-to-home move. And so I'm going to start really quickly by talking about some of the complexities of the adolescent parent experience, and that really serves as the backdrop for this research. So first of all, adolescent parents and pregnancy and parenting serve as the backdrop for this work. And really, this pregnancy and parenting experience can be associated with certain factors that place these groups at risk for poor health outcomes. And so when compared to adult-aged parents, adolescent parents have a higher economic status, the risk for having had adverse childhood experiences such as child maltreatment or neglect or exposure to violence in their past. They have a higher risk of pre-existing mental health diagnosis, as well as risk-oriented behaviors such as substance use or delayed prenatal care. And so these social determinants of health inequities and the coexisting risk-oriented behaviors can have a significant impact on the health of the young mother. These also increase the risk of the baby requiring NICU admission after delivery. And so if the social and emotional and health risks were not complex enough, in addition to experiencing this critical illness of their infant, parents in the NICU often experience emotional and psychological consequences related to this hospitalization. And this is parents of all ages. And studies have investigated this prevalence and the longevity of these symptoms for many years post-discharge, with some parents expressing symptoms of depression, feeling stress, anxiety, and exhibiting symptoms of PTSD long after discharge from NICU. And so studies reporting on the experiences of adolescent parents, while fewer than the studies reporting on any age parents, still confirm that adolescent parents experience these similar impacts. And so there we have the kind of the risks associated with being an adolescent parent and the NICU experience. But what is happening for the pregnant and parenting adolescent is that they often report negative experience of the healthcare system in general. And so this is what's also going on in their lives. So they report feelings of stigma when they experience the healthcare system, lack of trust with their healthcare providers, as well as contextually or developmentally irrelevant programming. So the programming is targeted towards the adult-aged parent, and they feel excluded in some of the programs that are developed for parents and supporting parents. Another example is that adolescent parents often report assumptions by providers about use of substances, or they assume that Child Protective Services is going to be involved based on their age alone. So they do have this negative healthcare experience when they are a pregnant and parenting youth. And then finally, the main topic, and as you heard in the introduction, when we look at this situation from and a holistic view of transitions, this can really bring some important understanding to the adolescent parent experience. And so what I mean by this is that when we typically think of transition as going from point A to point B or a change in situation, there are really many other types of transition events. And these include developmental transitions, health illness transitions, organizational transitions. And so in addition to these, in addition to the situational transitioning that's happening when we move from NICU to home. And if you have a peek at the illustration, we have our young mother at the center. And we think first that the first transition that this young mother is making is that transition to motherhood or parenthood. So this starts taking place even before the baby is born, as they're starting to adapt to that parent or mother role. And then there's a transition that takes place when the baby's born early or baby's born sick or unwell. And that is, that transition to what it means to parent in this context. And the uncertainty or the unexpectedness that comes along with having a baby in the NICU. And then the transition that we often think about is that transition from hospital to home. So when baby is ready to come home and be cared for at home, we often think of that as the main transition. But when it comes to the adolescent parent, they're becoming a mother. They are coming to terms with what it means to care for your infant when they're ill or in the hospital. And then they're being asked to move from the hospital to home. And all of this is happening in the context of becoming an adult. And so all the associated changes that are happening in their lives and in their brains even that are associated with this stage. And when I do talk about these overlapping and intersecting transitions, I often say they're experiencing at least 4 intersecting transitions, because there may actually be more when we look at transitions in this more holistic way. I think of the example of a parent who's maybe struggling with their own mental health or well-being while navigating the NICU, that adds that additional layer, and that they're transitioning in that experience of their own health and what it means to take care of yourself while also taking care of someone else now. And so this exploring this complexity and the potential and all the multiple vulnerabilities for mom and baby was really the backdrop of my research study. And so I'll talk briefly about the study and how it was conducted, and then get to the findings and implications, which I think will be the most interesting part for this audience. So this study, it was a qualitative study where we interviewed participants, and 2 groups of participants. First, we asked mothers or parents to tell us about their NICU-to-home journey and about the important events and people that happened along that journey. And then we also asked health and social care providers to tell us about their experiences caring for young mothers who have had their newborns in the NICU. We also asked them to imagine the best possible person, program, or service that would help facilitate a successful transition for these young families. So in the study, there was a total of 23 providers who participated. This was a mix of registered nurses, nurse practitioners, and social workers. And they represented both the NICU as well as the community settings. So some were situated within the NICU units themselves, and others in community programs or organizations that would encounter parents who have had babies in the NICU. Unfortunately, the parent arm of this study was paused during the pandemic. So when I do talk about the findings, they do represent primarily the provider perspective. However, the few interviews that happened with families are definitely infused into some of the findings, and the parent experience portion of this study remains ongoing. And I do just want to share one quick slide about some of the really unique ways that parents are sharing their stories, and how this information is being captured. And first, parents are drawing timelines. So they're drawing out those important milestones that took place on their NICU-to-home journey, as well as something called a relational map. So they're really highlighting in these maps the relationships, in their lives, and how those were affected by their NICU experience, as well as that journey to home, and how some of those relationships may have changed. So some of the findings of this study, they really highlight the importance of understanding the impact of that NICU experience on the lives of young mothers. So specifically that this is a unique population with complex social, emotional, and developmental needs. And also that the NICU experience, or that care context of the NICU can be perceived as traumatic, which was really seen as influencing some of the really important outcomes that we see in the parenting experience, such as attachment or attaining that parenting role, as well as their own mental health and well-being, which we know can be so important for things like attachment and feeling confident and competent in the parenting role. Another important finding is really that that there needs to be an understanding of that NICU experience, and then being able to address this impact before transition can be seen as successful. So if a parent is struggling with the traumatic effects of the NICU experience, that's going to hinder their overall transition success. So that idea, and I know we say this, that discharge is happening day one, and that process really begins early in the admission. This is really seen in our findings as well, that we can really support that transition success by addressing any impacts that might be happening while families are in the NICU. And for the adolescent parent, this was specifically looking at targeted or tailored interventions that would focus on establishing relationships or supporting mental health in the NICU, as well as the adoption of a trauma and violence-informed care principle or method of care. And this can really help to reduce any potential for traumatization or re-traumatization, knowing that the adolescent parent population often has a past that may have, where they have experienced trauma prior to encountering the NICU. And finally, and this may come as no surprise to this audience, but findings of this study really pointed to a fragmented system where healthcare and social care, as well as primary care and tertiary care systems, lacked an integration. And this was really seen as being difficult for patients, parents, and families to navigate across those systems and find, really find the care that they need in the right place at the right time. And so some of the recommendations, so really how can we mitigate some of this impact that we saw, or support resilience in young mothers when they are in the NICU? So the first, really what came out a lot from providers is there is a real teamwork, great teamwork in the NICU. It is a well-functioning interprofessional team generally, but perhaps there could be additional layers of support added to that team, specifically focused on supporting the complex social, emotional, or psychological needs of the families. So this could be mental health professionals added to that NICU team, whether it be counselors or psychologists or mental health nurses, really focused on that emotional support. This was also seen as being important for the NICU team themselves. So having that layer of emotional support for NICU clinicians and staff, knowing that the NICU environment can be traumatic at times, and being able to support everyone who is involved. The second real way we can look at supporting resilience or mitigating some of this impact that the NICU may have on young parents is looking at a role, the potential for a role for public health nurses within the NICU. And so public health nurses are often involved with young families with higher needs or potential risk factors in the community. And so these public health nurses are well connected to health and social programs that are meant to be supporting these families. And so is there a way for these nurses who are so experienced with this population to be brought in to the NICU to meet these families and to start supporting them early on to help smooth that transition to the community, so that there's a familiar face and somebody who is very familiar with those resources for families in the community. And then third, really looking at this trauma and violence informed approach. And so when providers understand the life circumstances of the mothers and the families that they care for, and they aim to acknowledge and reduce things like implicit or explicit bias towards adolescent mothers, or recognize the potential traumatizing effects of the NICU environment, and really actively support efforts toward mitigating impact, all of these can help reduce any harm that might happen, or any harm related or re-traumatization that might happen when somebody does have past experience of trauma or violence or adverse childhood experiences. So when the entire unit commits to this trauma and violence informed approach, can really be beneficial for anyone who is cared for in that environment. And then there's also some recommendations stemming from this work that address that system fragmentation. And these can include co-locations of services for parents within pediatric settings. So making sure that the services that parents might need are easily accessible in the same place that their child is receiving care. And so whether that be mental health support or the resources that they need to meet some of the social needs, are these easily located where their child is receiving care? Or are they having to cross some of those systems or some of those divides to actually get that care for themselves? And then on that, looking at a navigation piece, and we hear the term navigation, somebody that helps people find their way to cross these divides or navigate a system that may not be a smooth or direct path. And again, helping parents find the care and services that meet their needs, and then that meet the needs of their child. And then finally, looking at opportunities for intra-professional collaboration. So again, it came out really strong that the NICU team is a good interprofessional team, but sometimes we need to look within our own profession. And so the nurses who were participants in this study really felt like they could collaborate better with other nursing teams that may have different knowledge and expertise, such as the NICU nurses and the public health nurses, and that this collaboration could really help support families in transition, and whether that be bringing in public health nurses into the NICU setting to help facilitate that transition, or that it's NICU teams helping provide education to public health teams so that they can best support families who have been in the NICU and had that experience, and how they can best support once families are in the community. So that's really a overview of this study and really the work that I've been doing. And I'm really excited to have some questions and discussion with this group.
Thank you so much, Liz. It's incredible. The amount of work you've already put into it. And as we said before, this kind of gap that's sometimes overlooked. And so I'm wondering if you have a handle on the numbers of families who would fall into this category of adolescent.
So that's a really hard number to pin down, but I actually had one of the NICUs in Ontario just run some rough numbers for me, because it's not something that's typically captured on the typical data that we report on parents. Is we don't typically report on their age. So I had one a level 3 NICU in Ontario just run their numbers, just a brief look, and it was around between 5 and 7% of their parent population. So it's small, but it's not nothing. So these parents are in the, and that was age, I believe, 20 and under, which I know we've had a discussion, and I'm about the term adolescent, and what does that really even mean? Does the second somebody turns 20 or 21 all of a sudden make them an adult and not in need of some of this, whether it's targeted services or specialized care? So, but it's not an insignificant number. And when you do look at studies that evaluate risk for a baby being in the needing a NICU admission, adolescent age is actually a risk factor for a NICU admission, even when controlling for things like socioeconomic status or prenatal care and that sort of thing. So age actually is a risk factor. That is a good question.
Tell us about, I'm really interested in how you're going to, I'm interested in how you're going to reach this population. So I know COVID kind of threw a wrench in your plans, but can you share with us? I feel like this is a very difficult group to kind of reach to even get this information.
So it was really important for me to partner with public health. So you'll notice that I've mentioned public health nurses a few times in the findings. And so when I spoke to providers, I spoke to they're in Ontario, and it's a program that's been piloted in BC as well as in Ontario, and it's widely adopted in the US. It's an evidence-based home visiting program for particularly young mothers, young first-time mothers, usually with risk. And so it's called the Nurse Family Partnership. And this is an intensive evidence-based home visiting program where the nurse is actually paired with the mother before 28 weeks gestation. So partnering with these nurses really helped me kind of tap into who was already providing services to these families. And so one of the goals of their program is obviously healthy pregnancies and healthy babies, but we know that, sometimes babies do need NICU care, and sometimes babies come early, sometimes babies are born, unwell. And so those nurses were instrumental in connecting me with the moms that were in their program that ended up in the NICU. And so these moms were fortunate, though, that they were already kind of caught into a safety net, so to speak, of support. It's the ones that maybe aren't already involved in a program such as this, that it's harder when they do come in the NICU and they don't have that, that support system already in place. And so I also, NICU nurses they know their population well. They're they're the 24-hour eyes on. And so they were also helping, recruit for young women to speak to, but it is a challenge. It's not, it's a small population, and it's also sometimes a little harder to reach because of some of the factors I spoke about. It's hard for them to trust the healthcare team because they've experienced things like bias and stigma, and that's unfortunate.
Right. We do have a question here from Judy that says, anything specifically aimed for adolescent dads? As we know, sometimes the focus ends up more on mom and those kind of support groups. So is there anything specifically aimed for adolescent dads?
Yeah, that's a great question. And I think a lot of the recommendations can really be applied to parents. So if somebody's struggling with with mental health is there support to support whichever parent that may be. I know that there's, just anecdotally and speaking to some of the provider teams, there's an emphasis on whether it's specific chats, or I think one group was doing a pizza night for dads that was helping. But again, it's hard when there's a program that's kind of generic to be the one young dad. And so I think there's definitely still a gap, one for that tailored to adolescents. And then I would say even more so, if we're tailoring to adolescent dads, that's a very, very tiny population. Not, but not that they don't have needs that would be probably unique and worth looking into what could be there to support them.
I have one more question for you, and then I'll let you go. This is an awesome topic. So I would like to know, what are your next steps? What's next for you in this area of research?
Yeah, fantastic. So obviously finishing up some of hearing those experiences from the parents themselves. As I mentioned, the pandemic put a pause on data collection. I showed you some of those timelines and maps. You can imagine how challenging it is to do that kind of research over Zoom when there's restrictions, and again not having the partners in place, again partnering with public health and nursing teams, having these partners in place to help find the right people to talk to. So that was on pause, but finishing up, collecting those stories from young women who have made this transition is hopefully in the very near future that those stories can be gathered and synthesized in a way. There's, when you can take a whole bunch of individual timelines, there's a method where you can synthesize these timelines together and produce a really nice map of what it may look like on, a more less an individual level, but more that group level of what it looks like for a young parent to make this journey. And then when do you have, some of those touch points, where are the tension points on that journey? Where are some of the points where, moms maybe struggled the most, parents had the biggest challenge with, whether it's something social, emotional. When you have that nice map, you can start to plan interventions around that. So knowing that, it's maybe not that first week that we think, oh, it's so going to be so hard in that first week when they get home. Maybe it's something, down the line that they struggle with. The one example that comes to mind from a parent was not feeling like there was a parent group for her. So once she, got over the initial NICU experience and was feeling comfortable at home and ready to kind of like go out and interact with other moms and babies, there was her friend group who didn't have babies. So she felt like she didn't belong to her peer group anymore. And then there was the mom groups that were all older. And then there was the groups that were kind of a mix, but their babies hadn't been in the NICU. So really feeling like there wasn't a group for her. So looking at that, I think peer support might be particularly interesting as well. And I know that that's a big driver of things with the preemie group here, that may be an interesting next step to seeing what can be there for a younger mom who maybe doesn't identify with some of the other groups anymore that they might fit in.
For sure. Well, I am excited to see where you go with this research and to kind of see the next steps as you gather stories. And so thank you for joining us today and sharing this very exciting research.
Absolutely. Thank you so much for having me.
For everyone watching, thank you for joining. And all of the lives from our live Preemie Chat series are available on the CPBF website. And again, that is CanadianPreemies.org. And CPBF is a charitable organization, and it believes that through education and support, families will be empowered and ready to care for their baby. So visit their website and consider making a donation. Together, we can create a brighter future for all of our NICU families. We're going to be back here next week, Friday, 1 p.m. Eastern Time, and we're going to be looking at a story of resilience and determination. We'll have an in-depth interview with an adult preemie and her mother. I hope you can join us.